Hey, I'm Dr. Jeannie Buckner. I'm an orthopedic surgeon and I work with Roper St. Francis Physician Partners. As an orthopedic surgeon, I treat patients with complex hip and knee problems. So I primarily treat arthritis. So I do joint replacement, replace the hip, replace the knee, can even do partial knee replacements. Additionally, I take care of fractures. So trauma is kind of the heart of all orthopedics. So if you fall and break your hip, I take care of that. Break your leg, I take care of that, and follow up all those things. So trying to optimize function for people. Whenever I first meet a patient, I'm excited to kind of get to know them a little better and see what their problem is. You know, everyone's different, and an x-ray isn't the patient. So just because you have arthritis doesn't mean that you necessarily need a knee or hip replacement. It kind of depends on where you are, and I look forward to discussing and figuring out which treatment route is best for you and coming to a shared decision making of the best way to move forward. As a former Division I basketball player, I've always been very passionate about mobility, activity, and people kind of optimizing their function. That's kind of carried forth through orthopedics, and the fun thing about joint replacement is that you get to kind of give that mobility back to patients. So you have someone who's got crippling hip arthritis. They used to be an athlete, they're used to hiking, maybe they're 60 to 80 years old, and now they can barely walk without pain. You do their hip replacement, and 3 weeks later they're walking, doing things they want to do, and able to maintain that active lifestyle throughout the rest of their hopefully very long life. I grew up on Johns Island and absolutely loved it. I love the low country, I love the people here. It has always been my goal to come back and practice here. I trained down in Florida and then in Mississippi, and it's just a blessing to be able to come home and take care of this community. I think it's a special community because you've got a mix of island people, Charleston people, Mount Pleasant, North Charleston. There's all these different personalities and cultures, as well as different people who have moved to the area, which is exciting. There's locals that have been here forever, and I think it's just a very vibrant community, and I feel very blessed to be back here and able to take care of all of these special people.